Weddings were postponed, funerals streamed on Facebook, mourning rituals were whispered behind masks, grief went digital, but never lost its depth. It wasn't always loud, but it was always local, always human. Welcome to Omar's Story Nook, where history gets spicy, legends get a remix, and imagination runs wild. Every tale you hear is a whisper of Omar, echoing across time, culture, and the soul. Early 2020, a virus circled the globe, invisible, relentless. It shut down cities, emptied streets, filled hospital corridors, and the world turned its gaze toward Africa, not with hope, but with dread. They said, when COVID hits Africa, it will be the worst. They pictured bodies in the streets, systems collapsing, famine, chaos, a total unraveling. But something else happened. Africa didn't follow the script. Africa adapted, fought and survived. This is the story of a quiet miracle. The predictions, the panic, and the people who changed the ending. The virus hit the West first. Italy gasped. New York panicked. Hospitals overflowed. Sirens became the city's heartbeat. The world scrambled for PPE and ventilators. Then the cases came. Nigeria, South Africa, Egypt, Kenya, and the headlines grew louder than the facts. Weak hospitals, no ventilators, crowded cities. It's going to be catastrophic. The world didn't just expect tragedy, it was ready to film it. But while others braced for collapse, Africa moved. Labs pivoted overnight. Testing centers popped up in unlikely places. Converted market stalls, university labs, even mobile clinics parked under trees. Borders closed quickly. Weeks ahead of the West, health messages were translated into dozens of local dialects. On the radio, on WhatsApp, on the side of delivery trucks. Public hand-washing stations sprang up everywhere. On sidewalks, outside mosques, even at taxi ranks. And by the time the world was still debating masks, Africa was already wearing them. People weren't waiting for a perfect solution. They acted. While others underestimated, Africa activated. When the economy stalled, the people rose. In Uganda, border riders, motorcycle taxis, delivered food and medicine to the elderly who couldn't leave home. In Ghana, local engineers built makeshift ventilators and 3D printed face shields in university labs lit by backup generators. In Nigeria, youths built WhatsApp hotlines offering real-time medical guidance to people in areas with no doctors, just smartphones. Was it perfect? No, governments were inconsistent. Some lockdowns were brutal. Misinformation still slipped through cracks. But communities? They showed up in crowded refugee camps, in remote villages, in sprawling urban townships. Ubuntu lived. I am because we are. It wasn't just a proverb. It became a practice. Neighbors cooked for one another. Youth groups handed out soap and masks sewn from scraps of Ankara cloth. Even the sacred had to adapt. Weddings were postponed. Funerals streamed on Facebook. Mourning rituals were whispered behind masks. Grief went digital, but never lost its depth. It wasn't always loud, but it was always local, always human. Then came the vaccines, and so did the inequality. The world's richest nations bought them all. Before most had even left the lab, the US, UK, and EU stockpiled millions of doses, enough to vaccinate their citizens 5 times over. Africa waited, watched, and received leftovers. COVAX was launched. Hope was promised. Equity was the slogan, but delays followed: bureaucracy, supply chain failures, politics. The world reopened its cities, while Africa waited at the back of the line. But the struggle wasn't only external. Inside, something else was growing: doubt. Some believed, others hesitated. Generations of colonial medicine and pharmaceutical exploitation left deep scars. Why now? Why us? Why so late? And in that vacuum, conspiracy spread faster than the virus. Across mountains, rivers, deserts, health workers pressed on, village to village, megaphones in hand, vaccine coolers strapped to their backs. One nurse in Malawi worked 8 hours to deliver 6 doses. One elder in Lesotho hosted a storytelling night about why the ancestors would have chosen science. Their message was simple: hope is here. Take it. And some did, and some didn't. But the choice was offered with dignity. By 2022, the numbers stunned the world. Africa, the continent predicted to break first, had some of the lowest COVID death rates per capita. Why? Was it luck? No, younger population helped, yes, but so did experience. Decades battling Ebola, HIV, malaria. Public health here wasn't just about hospitals. It was about the people. Health wasn't a building, it was a community practice. Mobile clinics, community elders, storytellers turned educators, mothers with radios and market megaphones. Yes, systems were strained. Yes, corruption appeared. Yes, many were lost. But the collapse the world anticipated never came. Africa didn't fall, it pivoted, it persisted, it adapted. And in doing so, it reminded the world of something it often forgets. Resilience doesn't always look like steel. Sometimes it looks like a bar of soap passed between neighbors, a grandmother tying a homemade mask around a child's ears, a WhatsApp prayer chain, a TikTok dance about hand washing. Africa didn't just survive COVID, it rewrote the story in a way no one saw coming. The world expected disaster, but Africa answered with dignity. They expected collapse. What they got was community. This wasn't a crisis of weakness. It was a lesson in strength, a lesson that still echoes in alleyways and boardrooms, in digital classrooms and open markets. Because sometimes the most powerful response to panic is not perfection, but people. Until the next whispers of Oma, stay listening.